nature of the beast, hanging out at an airport.
Great.
My name is Kevin Argentieri. I am one of this year's EMS fellows here at the University of Michigan. I came from one of the UPMC hospitals at Harrisburg for residency, where I came from a 3-year program. So did a residency in emergency medicine. In a prior life, I was working in EMS, and so naturally gravitated towards EMS and wanted to continue pursuing that field after residency. So.
Yeah, it seems natural that like people who start EMS earlier on, they want to continue and go into emergency medicine, or obviously like working like an amazing hangar like this. When were you interested? Like when did it start?
So it was my interest in EMS.
Yeah.
So my mom was a nurse paramedic before I was well before I was born. My dad was a PhD pharmacologist, so my siblings and I were certainly genetically predisposed to medicine. I had I would say, fairly unique path. I started in EMS during undergrad. I went to the University of Vermont, and I knew enough about medicine that I knew that going to med school was like a really big undertaking. And I knew coming out of undergrad that I was not ready to take that on. I was fortunate enough to have somebody before undergrad, a family friend of mine who's an OBGYN, say that, unless you love bio or you love chemistry, you can be pre-med and study whatever you want. So I was actually an economics major, and I just kind of wanted to find my own way. Like I still did all my pre-med stuff during undergrad. I spent a lot of time doing EMS, spent a lot of time in the outdoors. When I graduated from undergrad, I got super lucky, and I managed to land a spot on the mountain rescue team in Park City, Utah, and did that for 3 years.
Sweet. So when was EMS like? What started that? Like, is it just like all the outdoor stuff? Because obviously, like, I feel like everyone I hear about in EMS sort of has like this profile of like being outdoorsy or like into sort of like more like I read your profile on the website. You went to like sailing. You went to, I think you sailed somewhere before medical school.
Yeah. Yeah. I've always been an outdoors guy for sure. I mean, I think I'm definitely somebody whose brain likes to ping pong all over the place, and so emergency medicine is great for people like me. But my interests are many, and I think EMS is one of those things that allows me to do a lot of different things and constantly kind of be changing what I do and the encounters that I have with patients. EMS was originally like an avenue for me to get into medicine. Actually, so my first ever course was a wilderness first responder course during first year of undergrad, and then it just kind of snowballed from there. I started volunteering my time outside of my usual undergrad curriculum, and then it just kind of took off from there. But yeah, I mean, like after Utah, 3 awesome years in Utah, I'd spend my summers back in Vermont, working as a tech in the ER in Burlington, and then winters out in Utah. And then I found my way to Seattle. I guess I wasn't quite ready to go to med school, so instead I bought a boat.
How old were you?
So undergrad was an extra year for me, so I took 5 years in undergrad just because I was packing so much stuff in. I lived abroad for a while, and I got a great education at UVM. But so 5 years of undergrad, I graduated in 2010. That would have made me 22-ish, I guess. 3 years in Utah, and then 3 years in Seattle, and then I went to med school. So I turned 30 my first year of med school.
Wow. Yeah.
And I wouldn't have done it. Looking back, I wouldn't do it any differently. It was what I needed to do to be comfortable with who I was as a human, and have the experiences I needed to have so that I would be able to go to med school, dedicate myself, and not have any regrets that I had missed out on something. That's one of the biggest pieces of advice I think I could give anybody who's interested in going to medicine. You don't have to be a bio major or a biochem major, okay, number one. Number two, figure yourself out, before you go to medical school. You don't have to go right away. Find out who you are, what makes you tick. And I think it's a lot to ask anybody who's 22 or 23 years old to go to medical school and have them be confident in who they are as a human.
So that's 6 gap years, right?
Yeah, so 7 if you want to include my thesis year that I was spending at UVM, but I don't know how. Yeah, it depends how you define gap year, right?
Sure.
Like those were very productive years for me. I met the woman who's now my wife. You know, we sailed to Alaska and back. You know, and there was so much fullness in those years that, and again, like, yeah, I was a little bit older, but yeah, absolutely worth it.
Okay, and so I'm going to ask like a very general, broad question. Take it however you want.
Sure.
How would you define emergency medicine?
Emergency medicine is the practice of encountering a patient wherever they are in their world and addressing their acute need. It certainly gets frustrating when somebody comes into the ER with the sniffles and says that they're having an emergency. And first and foremost, my job is to make sure that they are safe, okay? And the reality is that the person who defines what an emergency is the patient. It's not me, all right? And so I have to meet them on their level and identify what their need is in that moment. And for that patient with the sniffles, it might be reassurance. Medical literacy is all too uncommon in our society, and I cannot expect somebody to have the same knowledge I do in identifying whether or not they need to seek care. So a lot of my job is education.
Would you say you're sort of like on the front line?
Absolutely, yeah. I mean, like, we are the safety net, right? I don't care what anybody tells you, like, our healthcare system is fundamentally broken, right? And I am the first person that a patient encounters often with their healthcare system, and often I am the last person that they encounter because they have no other access to care. And it is my responsibility as a physician to be that person for them when they need that person and they don't have access to anybody else. That is as big as part of my job as anything else.
And would you say like you have unique responsibilities just sort of being on that front line versus any other specialty in medicine, or?
I mean, I think we all have a duty to be advocates for our patients. My job is a little bit different than, say, a surgeon or an anesthesiologist or even a family practice doc. Yes, there's overlap with all of those docs, right? But you know, when I got into emergency medicine, like, one of the motivating factors was this idea that I was going to see a slice of society, and everybody, you know, rich, poor, a man, woman, black, white. I was going to see everybody. And I was wrong about that, because the burden of disease is so disproportionately shared amongst people who are less fortunate and from lower socioeconomic demographics. That really struck me as a responsibility for ensuring that those patients have a voice, ensuring that those patients have an advocate, ensuring that those patients receive the care that they, the best care that they would otherwise not have access to.
And obviously we're not in a hospital right now, so where would you find an emergency medicine physician? Where are all the places you could find them?
So certainly in the emergency department is where you're going to find most of them, but there's many folks like myself who go out and pursue additional training. And so the paths beyond an emergency medicine residency include critical care, they include palliative care, they include ultrasound, they include EMS, they include medical education, they include toxicology and addiction medicine, right? And so you can find emergency medicine trained physicians out in the community providing healthcare to homeless populations. You can find emergency medicine physicians working in ICUs. You can find emergency medicine physicians staffing, flight programs and working with paramedics and teaching. You'll find them in the classroom setting, working with residents and medical students. The path beyond the emergency department, there's lots of opportunities. I still love the ER. I still work in the ER. I don't intend to ever leave the ER, but emergency medicine residency, one of the things that I learned is that I need to diversify what I do. And for me, my passion beyond the ER lies out in the field, working with paramedics. My role as an EMS doc is not to come in and save the day. My role is to empower the paramedics and the EMTs within the system that I work to function at their highest and best capability. That comes in the form of oversight, that comes in the form of education, that comes in the form of field time, helping them carry the bags, helping them manage the airway, helping them get that IV, just being an extra set of hands. I'm not there to be the team leader on a call out in the field. I'm there to be an extra set of hands. Emergency medicine is a team sport. Of course, EMS is as well, and just being able to be a part of that team is really what gets me excited to come to work every day.
And so obviously you're an EMS fellow. Could you speak a little bit about your experience with fellowship? What made you really want to choose this particular fellowship, and what your plans are after?
Yeah, sure. Again, my medical career began in EMS, right? And so when I was predisposed to kind of wanting to go in the direction of emergency medicine, but when I got to medical school, I made a commitment to myself that I was going to prove to myself that I did not want to do emergency medicine, okay? To make sure that I gave everything else that I didn't have experience in a fair shot. I loved surgery. I loved the OR. Decided I did not want to be a surgeon and sort of everything else that goes along with being a surgeon beyond just working in the OR. That intensity of focus on one patient at a time is really something that I loved, and certainly not something that I get commonly in emergency medicine in the emergency department. I delivered my first baby as a third-year med student, and there was about a 6-hour period of time where I was like, oh my God, this is the most incredible thing. I'm going to be an OBGYN. But that kind of faded, and ultimately, the emergency medicine appealed to me. The idea of being the jack of all trades, master of none. I get to see old people, I get to see sick people, I see injured people, I deliver babies, I do everything. I get to have a role in the acute phase of illness and injury, and I love that. And so I failed to prove to myself that I wanted to do anything else, and so I did move in the direction of emergency medicine. When I got to residency, I was by no means convinced that I wanted to do a fellowship. I mean, emergency medicine residency is not no residency is to be taken lightly, and just getting through residency was my first and foremost priority. But it was second year that I was like, I really need to diversify what I do. I love emergency medicine, but I wasn't confident that I wanted to spend the rest of my career working in the emergency department every single day of what I do. And based on my background, EMS was the logical direction to move in. As we were talking about earlier, I do come from a family of pilots, and the opportunity to fly and incorporate emergency medicine into aviation and aviation into emergency medicine is just such a cool thing that I wanted to pursue, and EMS fellowship is the logical direction to move in if you want to do something like that.
Right.
I love the outdoors and I love wilderness, and so wilderness medicine is also a passion of mine, and yes, you can do a dedicated fellowship in wilderness medicine as well, but within EMS I still get to do a lot of wilderness medicine stuff. So EMS is a good home for me.
Right.
It's a 1-year fellowship typically, and it set me up to do exactly the work that I want to do. And so in a few short weeks here, I'm going to be headed back to the University of Vermont, where I'm going to be taking a faculty position at UVM and working within the division, their division of EMS.
Right. And so do you see training students and residents and other medical students? Is that a part of your career going forward? That I know you mentioned medical education is important to you.
Absolutely, yeah. Part of the public health duty that I have is to ensure that our paramedics are working at their highest and best use. Whatever I can do for them in terms of education, in terms of quality assurance, quality, I want to be a part of. I want to be a force multiplier, okay, for the health of my community, and for me, that comes through the eyes, the ears, and the hands of the paramedics.
What would you say was the hardest part about emergency medicine residency and also just the job every day?
The hardest part of residency, no doubt, is the hours, the toll that it can take on your family, being away from home so much. For me, that was one of the things I needed to figure out in life before I ever moved in the direction of medical schools. I found a partner in life who empowers me to be the best version of myself, to be that doctor, to be that force multiplier. And I'm really, really, really fortunate to have that person in my life. I know a residency was incredibly hard for her. And I am so grateful that she helped me through that. She helped enable me to go to work every day and not feel guilty about it.
Right.
That was one of the hardest parts about residency for me. Finding that balance is really hard, and there's no single piece of advice I can give to anybody. Finding that balance point is going to be unique to anybody's unique life circumstances. In terms of the work that I do every day and the difficulty that presents, certainly the more time you spend doing it, the more of a flow you can find. Knowing what your tools are and knowing when and how to use them. However, when a 4-year-old gets hit by a car and you need to break the bad news to parents that their child has died, there is nothing that prepares you for that. There is no amount of practice that you can go through that makes that task any easier, and it's hard. There are moments in this job that you carry with you forever. Not something, if that is something that you're not willing to accept and not a burden you're willing to shoulder, then emergency medicine is not for you.
Right.
At the same time, the opportunity to make that difference in that patient and that family's time of need, that is what keeps me coming back.
Right.
And so it's like anything else, there's a balance. There's highs, there's really, really high highs, and there's really, really low lows. Sharing in those highs with your team, with your nurses, during residency, with my co-residents, that's what makes it worth it. Yeah.
Any really meaningful patient encounters that sort of showed you like, okay, this is really why I wanted to be a doctor and also why I chose this path?
The one that immediately comes to mind is a woman I cared for during residency who had metastatic cancer. She was very ill. She was going to die, and eventually she did die. She came into my emergency department with difficulty breathing, and I ultimately diagnosed her very easily. It wasn't a rocket science, but found a fluid collection around her heart within her pericardium, something called a pericardial effusion, which is unfortunately not an uncommon condition for patients with advanced cancer to find themselves in. And she got admitted to the hospital. She had that fluid drained, and she could breathe better. There was no definitive solution for this problem for her. I saw her during multiple emergency department encounters, and being able to work with her in the final months and final days, or weeks and days of her life, and listen to her and try and understand. There was so much chatter in the background. There was her family, and there was her cancer doctors, and it's so easy to focus on the disease process and lose track of the actual patient and human behind that disease process. And it was an honor for me to be able to sit with her and talk with her and identify what her priorities were, and ultimately connect her with palliative care to ensure that she died with dignity on her own terms. I actually encountered her daughter in a completely separate emergency department encounter. Her daughter was there for a medical problem that was very benign, but the daughter remembered me, and we talked for a while about her mother, and her mother had passed. Her mother passed peacefully, and the fact that I had some, at least small part in that. I went home that day feeling good about the work that myself and our team did.
So it's not always just about like saving a life. It's about like, you know, giving someone that dignity.
Absolutely. My job as a doctor is to maximize a sort of theoretical, mathematical product between longevity and wellness. Okay, and if either side of that is zero, well, then the mathematical product is zero, right? If you have lots of longevity with no wellness, okay, then that is not a life worth living. Okay, if you have super high wellness but no longevity, again, that is not a life that is meaningful and impactful. And my job as a doctor is, again, to identify what the wants and desires of a patient are, and to not just simply prolong life for the purposes of prolonging life. That is not the business that I am in. My business is to have the hard conversations with patients and with family, to try to identify goals of care when things are getting serious. If it's not myself, you know, who's going to be continuing the patient's care, you know, as the ER doctor, my job is to ultimately hand that person off, right? But the things that the care plans that we initiate in the emergency department have stickiness to them, right? You know, I start a patient down a pathway. If they leave the emergency department without having a goals of care discussion, sometimes, you know, all too often, that's a missed opportunity. I would say it's infrequently about saving lives, and it's much more frequently about connecting patients with resources for ensuring that they are comfortable and maintain dignity. The idea of emergency medicine when I got into it was, in fact, yes, I'm going to get to save lives. I do love saving lives. I don't think there's anybody who works in emergency medicine who doesn't get excited about like the resuscitation of acutely sick and injured patients. But the reality that I discovered is that patient is pretty rare. The vast majority of patients I see are not in life-threatening danger. Okay, and the thing that my role in that position is to treat whatever their minor injury or illness is, and connect them with the resources they need, and provide them with the reassurance that they need. On the other end of the spectrum there's a whole segment of sick and injured patients who are unfortunately going to die, regardless of what I do. And in that role, my job is to ensure that they are cared for with as much dignity as possible. But despite whatever I do, like, I know that there's nothing that I can do to prolong this patient's life, or to ensure that they have a great wellness in their life. And that Goldilocks patient, who's kind of falls in the middle, who's sick enough to really truly benefit from the care that I have to give, but not sick enough that their case will ultimately be, somewhat futile. That's a very rare patient, and you sift through all these patients on shift for days, months, weeks at a time, and then you finally find that Goldilocks patient, and it's exciting. It rejuvenates you. It gets you enthusiastic for the work that we get to do. So it's one of the things I love about flight medicine is that this job cherry picks, some of the most sick and injured patients, and it gives me the opportunity that I kind of had in the operating room to have that intensity of focus on one patient at a time, without all the other distractions of the other 15 patients I have in the emergency department. That's juggling the rest of my attention.
Right.
But
yeah, that's amazing. How would you describe like your average day? Like, what kind of, are there like common procedures you're doing, or common types of patients you see? I mean, obviously you said, as a phlegmatic and stuff, you see a lot of really critical patients. How would you describe like how you spend most of your time?
I spend most of my time in the emergency department at a computer. Okay, I want to be very upfront and honest about that, right? I also get to spend my entire day thinking about science, right? And thinking about pharmacology and physiology and disease processes and how I can work up a patient in a way to try to identify what's going on and how best to treat them. I am somebody who prioritizes time at the bedside, and so it's critically important for me to answer all the questions that a patient has. If there is a critical patient in that room, I will not leave that bedside until I'm convinced that they are stable. Sometimes there are multiple patients who are critical at a time, and I've got to juggle back and forth, and you kind of forget what's going on with the computer, and it stacks up, and it forms a big giant pile of documentation that's got to be done at the end of a shift, and that is a miserable task to get through. But the acute phase of resuscitation is just something that just excites me and motivates me so much that it becomes worth it. So to answer your question about like what does a typical day look like? Oh man, it is so varied.
Yeah.
It is so varied. During residency, so much of that would be dependent on my assignment within the emergency department for that day, whether or not I was working on sort of the general treatment side or a fast track side or the acute care side. That would kind of dictate the type of patients that I would see during that shift. Sometimes the emergency department is just rocking and you've got to churn and burn. And that can be really, really hard, especially when I have patients with a zillion questions to answer. But it's my job to again, like meet them on their level and provide them with the knowledge and information that they need to make informed decisions. This year, during fellowship, it has been extraordinarily varied. And so I'm typically trying to fly once a week with these guys, with Survival Flight, 2 to 3 days a month with Huron Valley Ambulance, out in the field with an echo unit, 2 to 3 days a month here with Livingston County EMS, again with my own echo unit. And then in between, in the EMS world, there is a significant administrative role. And so there's meetings to go, there's protocols to review, there's charts to QA, there's lectures to prepare. And so that diversity of the day-to-day, what I do, that's what motivates me and gets me excited. I am not somebody personally who could go into a clinic setting, an outpatient setting, and just see patients every day. I know that there are doctors out there who thrive on that continuity of care, that serial encounter, that established relationship with that patient. I simply don't have the attention span for that.
Sure.
That is not to say that I don't have my subset of patients in the emergency department, right? We are that safety net, and there are those patients who I see over and over and over again. It's this idea that I don't have my regular patient population, that emergency medicine, you don't form those long-term relationships. That's simply not true. It's certainly not to the degree as family medicine, but we have a responsibility to them, same as a family practice doc would.
Right. How would you say your life has been impacted personally, like outside of medicine, outside of your knowledge and your training, from being a doctor? Like, would you say, obviously being a doctor is more than just a job, right? How would you say that impact has manifested in your family?
So one of the appeals of emergency medicine for me was this idea that it was going to be shift work, right? You go into your shift, you see your patients, you sign out to the next doc at the end of your shift, you finish up your charts, you go home to your family, you're done. And I was wrong. I was wrong about that. This idea that it is just a job is is an illusion. There is so much that is wrapped up specifically in residency that if it is not a fundamental part of your life, it's a struggle. Not because I am exclusively defined by emergency medicine. I am a lot of things. I'm a husband, I'm a father, I am a skier, I'm a sailor, I'm a pilot, right? Like there are lots of things that define who I am, and medicine is just one of them. But medicine is, in fact, and by necessity, it is a big part of who I am. You cannot do this job and not go home thinking about some of your patients. Like, it's just impossible. You cannot do this job and sometimes take charts home with you to do because you're at the end of your shift, you're fried, you're not thinking like efficiently, right? And there's sometimes you just need to hang it up and go home, but there's still work to be done. I'm currently in that position. I worked last night and I've still got a mountain of charts to get through.
Right.
I don't think there's an ER doc out there who doesn't drive past a trampoline or a pool and be like, oh my gosh, there's danger. You don't see somebody who's speeding down the highway and be like, oh boy, there's a head injury just waiting to happen, a massive trauma waiting to happen. Somebody, you just sort of see the disease burden out in the world, same as a real estate agent or a mortgage broker might see, when they're driving by a subdivision, and the sort of the lens through which you see the world is, for me, is clearly through the lens of medicine and as a physician. It's fun. You gotta find the fun in this job, and so there are times that I will volunteer. It's quasi crazy to sort of think about it, to sort of taking what I do professionally and going out and on a weekend volunteering. But for example, like a couple weeks ago, I volunteered my time with the Detroit Grand Prix, and I got to be the pit lane doctor and get suited up in a fireproof suit and a helmet and be if there was a fire in pit lane, I was gonna get to be that doc in that moment. But that was a volunteer job, and it was super fun. And it is finding those opportunities to get excited for keep doing what I do. Medicine is a big part of who I am, no question about it. But if it's the only part of what you do, you're gonna be in trouble. And I don't care what field of medicine you're going into. If you are strictly defined by that, it's going to be tough. Yeah. I don't know how you become a neurosurgeon and not have that be exclusively what you do, because the training to go down that path is just so intense. Admittedly, more intense than emergency medicine, right? And I knew that I was not up for that task for being a neurosurgeon, right? So I'm thankful that there are people out there who have the ability to dedicate themselves to becoming neurosurgeons, but I know for me, it could not be that.
Emergency medicine sort of is known as like this notorious specialty for burnout.
Mm-hmm.
What do you have to say?
It is so easy to prescribe wellness, right? To mandate wellness. That is just such an empty concept. You have to, as an emergency medicine doc, go into it with the understanding that burnout mitigation is something that you have to be constantly aware of. And the way emergency medicine residency works, simply, I don't know how to fix it, but what we're doing now does not work. The documentation burden does not work. The hours do not work. I don't know what the solution is for the system, but for myself, I know that I need to do as much of what I can to ensure that I am staying true to all the other parts of myself that are defined by things other than medicine. Burnout mitigation, first and foremost, requires awareness of the problem, right? It is all too easy to just become consumed by your work, seeing the sniffles patient one after another, and losing motivation and an enthusiasm for what it is that we do. It is really easy in medicine, and including, especially in emergency medicine, to chase the money. And I started medical school at age 30, right? I turned 30 my first year of medical school, and I pride myself on saying that the money is not the motivating factor. There are so many other easier ways to make a living, and for me, taking an extra year of training to do a fellowship so that I can find a job that diversifies what I do on a daily and weekly and monthly basis was sort of really important step that I knew that I needed to take in order to partially mitigate the risk of burnout. And that was, I mean, there's no question, as a second year resident, I was crispy. I was pretty burnt. And I had deep and long conversations with my wife about this idea of taking on an extra year of residency extra year of training to identify whether or not I was going to be able to, to take the steps that I needed to find the path for me that I knew was going to be fulfilling on the long-term basis.
Right. How would you say is the best way to combat that? Is it sort of just looking for that fulfillment in life, in whatever specialty you choose? Is it the people that you have around you? I'm sure it's sort of a bit of both. What would you say?
It's identifying like the practice setting that you enjoy. So right now, the majority of the work that I do is in the clinically. The majority of my time is working in a community emergency department setting where I am the only doctor. It's fun in the sense that it forces me to make decisions. It's a really good experience for me to have out of residency, but I also kind of miss having that colleague right there with me to bounce ideas off of. I love working in that team dynamic to divide and conquer, and to get through that waiting room full of patients that are needing to be seen. Yeah, for me, it comes down to diversity. It comes down to diversifying the work that I do, enthusiasm for the team that I have, and maintaining the balance between the person that I am at work with the person that I am outside of work,
right,
and not falling into that trap where I'm exclusively a physician, right?
Would you say that the reasons you're staying in medicine are the same reasons you got into medicine, or would you say like there's sort of been like a frame shift?
There's certainly been a frame shift, no question, for the reasons we talked about earlier about sort of emergency medicine being not entirely what I expected it to be, requiring me to be not entirely the person that I expected I would be. But yes, for the most part, I am proud to say that if I had to do it all over again, I would still take this path. I would still go into medicine. There's still no other career path that I feel allows me, with my skill set, with sort of my brain, with the way I think. There's no other sort of field of work that I feel like I can make as big a difference in. And I still get to hang out around airplanes and helicopters.
Yeah,
so
that's awesome.
Yeah.
Yeah. Final question would be, if someone is sort of just like, sort of in my shoes, like not sure like what route they want to take.
Yeah.
And if you were sort of like the salesman for emergency medicine, what would you tell them about like, why this would be a great path to take, or maybe like why not if this doesn't suit you?
First and foremost, figure yourself out before going to medical school. I know that's a tall task, but I think it is so important to mitigating burnout, right? I think building taking the time to seize opportunity for experience, to foster relationships, to be confident in who you are and what motivates you before even starting medical school. Don't be afraid of gap years. Gap years are I learned far more during my, quote unquote gap years than I ever did in medical school, right? Those years had a huge part in helping me identify and define who I am. And I bring that to the bedside with me every single shift, okay? Medicine is a long road, and it is a long career once you get there. And it is a really, really long time to be miserable, okay? Unfortunately, suicide rates is very high amongst physicians, right? And that is something I am acutely aware of, right? Just that simple, those are staggering statistics that, bury your head in the sand and you don't maintain an awareness and appreciation for. You are setting yourself up for a rough road, and you're setting yourself, your family up for a rough road to go down with you. So I would say the single most important thing before going down the path of medicine is to be confident in who you are. Don't be a bio major or a chemistry major just because you want to be pre-med, right? Use your undergraduate opportunity to explore some other field that you will not otherwise have the opportunity to learn, all right? Because that also defines who you are and the lens through which you see medicine. For me, resource utilization and economics, this idea that I came into medicine with this, I can't do an MRI for everybody who comes in with back pain after lifting a heavy box. That is not sustainable, right? And the concept of resource utilization is something that is really woven into my practice, the lens through which I see medicine. Those experiences, those educational opportunities that I embraced before going into medical school are absolutely 100% define how I work as a doctor today. Shifting now to the advice I would give to a medical student, I would say go into medicine with a pledge to yourself that you are not going to be defined by what your expectations were for medicine before you ever started it, right? So we talked about, for me it was a pledge to myself. I was going to prove to myself that I didn't want to do emergency medicine.
Right.
And I'm thankful that opened up a lot of opportunity for me to explore different fields of medicine and help me define my practice and sort of my approach to patient care before I ever even got to emergency medicine residency.
Awesome.
Yeah.
Sweet. Did you have any other closing remarks before we sign off?
Thank you for giving me the opportunity to chat today. I will be headed to the University of Vermont, where I will remain available to anybody who wants to talk about a career in medicine or a career in EMS. And there are a lot of people who helped me along my path who I will never be able to repay. My pledge is to pay it forward, to do things like this, and to be that person for other people. Any opportunities I can do so, just give me a shout.
Sweet. Awesome. Thank you so much.
Thank you.
I really appreciate
Yeah.
your time.